Dr. Graham Brayshaw. I'm Director of Veterinary Medicine, basically head vet at Animal Humane Society. I oversee the policies and procedures when it comes to veterinary medicine and behavior for the organization. We get asked all the time, I get in my exam rooms, you name it, what's the right age to spay or neuter your dog or cat? And there are a lot of factors that go into it. It is you can give a pretty simple answer of now or 6 months of age or a year, but there really are a lot of things to take into account when you want to spay or neuter your animal. A very easy starting place is by 6 months of age, has pretty much been veterinary standard for years and I would say decades, not forever. But there's a lot of different factors to take into a place. So want a chance to go through today and we'll see, here's the various things to think of. You get this brand new puppy, you get this cute little kitten. When do I get them fixed? When do I take them to the vet to make sure we need to take care of it? First thing to look at, what are the benefits? Do I even want to get them spayed? This is actually a cultural, regional, and country by country decision. There are a lot of animals in a lot of countries that never get sterilized. It is not as standard in Europe, it's not as standard in other parts of the world. It's definitely standard in the United States. You think of Bob Barker, love him or hate him, he did actually a lot of good work for animal welfare, of mentioning on The Price is Right every day, get your pet spayed and neutered. That's because we have so much overpopulation. We're still there with cats, we're getting there with dogs, but not quite there yet. But if you have more animals than you have homes, or more animals that should be in homes than you have homes, either you have to have those animals stray, wandering, they have no home, you have to warehouse them and live in shelters and places you don't want to be long term, or you get where, fortunately we're not now, but had to be previously, euthanizing animals just for space. Needless death for animals associated with too many animals out there. So just dealing with animal population wise, you want to get your animal sterilized. It means we don't have as much dog or cat overpopulation. That is the doing best for the population as a whole, not just your individual animal. So that's really the big push. Animal Humane Society, we try and help the individual animals with us, but we also try and help the animal welfare community and the animal community as a whole. So that's why every animal leaving our shelters is sterilized beforehand. We have them spayed and neutered before they leave. That's not every situation where someone gets an animal. Most animals that people get do not come from shelters, so you are often making that decision yourself at home. When do I get them fixed? Do I get them fixed? In general, I would usually recommend a yes, do get them fixed. When is really what it comes down to. The benefits of spaying and neutering really depends on which sex you are dealing with. For boys, it's more actually prostate issues and behavior issues. Testosterone's great, causes a lot of muscle development, causes appropriate bone development, but testosterone also can lead to, I don't have to worry about it yet, but eventually benign prostatic hypertrophy. A lot of prostate issues can develop with time. Testicular cancers and things like that can develop with time. If you sterilize an animal, those are much less likely to occur. Interestingly, prostate cancer is actually no more likely in one versus the other. But testicular cancer, if you're neutered, you have no testicles, so there's no testicular cancer you can get, and benign prostatic issues can pop up, cysts, things like that, infections in your prostate gland. It's pretty common to see in an 8, 9, 10-year-old dog that's intact, non-existent in one that's been sterilized. So there's some good health benefits that go along with it. It's not completely benign on that side of it. There's often people worry about anesthesia and their animals. There are risks anytime an animal goes under anesthesia, which is necessary to properly do the surgery. The risks, and we do a ton of it here, are actually really small. The average across all veterinary medicine, if you deal with every 10,000 animals that get sterilized, 7 to 13, 0.07 up to 0.13% is kind of the range of anesthetic complications you see for routine procedures. We're on the low end because we do so much of it. About 7 out of 10,000 animals have life-threatening complications associated with anesthesia. It's a really tiny risk. And if you're looking at the other complications you can see with it, cost benefit, life benefit, it's really worthwhile on that side of it. The other part is it is a lack of testosterone afterwards. So you do have, you actually burn fewer calories. You do see animals more predisposed to getting overweight afterwards. That is just like our metabolism changes and drops with age. We're more likely to put on a little weight ourselves as we age. That change happens earlier. So you just need to make sure you're controlling the intake side of things. On the girl side of it, thinking for spaying and sterilizing our females, they do have actually greater risk if you don't get them sterilized. You know, for boys, benign prostatic issues, testicular cancer, you can get some behaviors associated with testosterone. For our females, every heat cycle they go through increases their chance of developing mammary cancer. That first heat cycle is that biggest jump, that biggest change. Usually that first heat is sometime around 7 to 10 months of age. It can sometimes change and vary there. So ideally we get them sterilized before that first heat cycle. As well, if they stay intact, let's say you do end up having a litter of puppies and getting them off to friends, and it's a nice, wonderful experience for you and the family, you still want to get them sterilized afterwards because they can get something called a pyometra, or an infection in their uterus. Treatment-wise is spaying, but it becomes an emergency surgery you need to do right away. It's an infection that is life-threatening, that can occur anytime as a intact female ages. So you really want to reduce that risk and get them sterilized. Behavior associated with sterilization, that actually has not been as well studied. There are general ideas that testosterone leads to aggression and leads to aggressive behavior. Intact with estrogen and progesterone, there's not as many behavior changes you see associated with it. There's really no good evidence out there that a dog that is left intact will be more aggressive than one that is not. The one thing we do know for undesirable behaviors or desirable behaviors is a lot of a dog's personality is pretty well set by about 16 weeks of age. A lot of a cat's personality is pretty well set by about 8 weeks of age. Their socialization window changes a lot there between species. And animals that are fixed later in life or don't get fixed later in life, many times they may be stray, may not have as consistent of an upbringing during that time, so they're not generally going to be as well socialized, which is going to make them more likely to have aggressive behavior or reactive behavior to something. So there, I don't worry as much on the behavior side of things associated with them being intact or not. It's really how well socialized during their socialization window that sets to a lot of it. There are a lot of studies out there now because it started getting looked at, especially thinking of shelters. We will sterilize the animals as early as 6 weeks of age, 8 weeks of age. You know, is that a good thing? Is that appropriate to do? And there's not any perfect data out there, but we're starting to get more research on it, more data on it. There's no good prospective study, meaning they've taken 100 animals and early sterilized 100 and not early sterilized another and compared them through their whole lives. But there's been a lot of retrospective studies trying to collect data of what's happened and see if there's differences between the two. Retrospective studies always aren't perfect data to look at, but that's the best we have right now. The potential downsides may be there, but are really complicated and don't have good evidence, versus the other end of we know the medical concerns that occur if you don't get them fixed. You will see information out there of, oh, you've got to wait on your animal to get them fixed. It's going to definitely cause these problems. It really depends on what you're dealing with there. So it's a pretty complicated answer. Well, there's a lot of information behind what actually is a pretty simple answer of yes or no or what age, but there's a lot of information to take into account. The nice thing is, if anyone really, if it's an animal I'm seeing in a clinic, we'll have this discussion, see what kind of lifestyle that animal leads, see the risks they may have in that lifestyle, and figure out the right age to do it. If it's someone where I've not seen the animal and I don't have that veterinary patient-client relationship, the answer is actually very easy. Ask your vet. because they will be able to have a discussion with you. They will have heard at least the most recent information that's out there on the right age and right time to do it, and really give a very good nuanced response of what's the right time for your animal. And really it comes down to you making that best decision you can for your animal with your veterinarian for guidance.